How do we know whether someone has NPD or NPD traits? Well, there's one way to discover this, and that is there is a great deal of confusion when it comes to the topic of narcissistic personality disorder. What I have found is that there's a lot of blurring between the two topics, the topic of narcissistic personality disorder and narcissistic personality traits. And if you watch enough video, you're going to see that the terms are often used interchangeably, and they shouldn't be. They shouldn't be. So I'm going to try to bring clarity to this situation. I'm Dr. David Hawkins, Director of the Marriage Recovery Center and the Emotional Abuse Institute, where we specialize in narcissism and emotional abuse. All right, so let's get on with it. Let's talk about NPD, Narcissistic Personality Disorder, and how that differs from NPD traits. All right, NPD. NPD has a sense, an underlying sense of superiority, for sure, as do those with narcissistic personality traits. It's typically a little less overt with NPD traits, but when I do an evaluation of NPD trait individuals, I often find an underlying sense of superiority. It's under there. So both have that. Number two, an exaggeration of talents. For sure with NPD, not so much with NPD traits. An exaggeration of their talents could be there, but not as overt, not as dramatic as with NPD. Number three, fantasies of unlimited power. Yes, with NPD, not so much with NPD traits. Not so much. Could it be there? For sure, but not so much. Number four, maneuvering tactics to gain admiration. All about me. For sure with NPD, and you can see it. I mean, like, braggadocious, all about themselves. Not so much with narcissistic personality traits. Could it be there? For sure, but the exaggeration is not typically there. It could be, not always. Number five, a sense of entitlement. Yes, with NPD, and yes, with NPD traits. A sense of entitlement. I deserve this. I'm entitled to this. Things need to go my way. So yes, for both. And then if you've watched enough traits, number six, watched enough videos, you will certainly hear about this one. A struggle for empathy, or a struggle to be empathetic. Absolutely with NPD, Narcissistic Personality Disorder, and often the case with NPD traits. They are emotionally immature individuals, and they have not worked to cultivate empathy. And yes, the good news about this one is empathy is something that can be cultivated. Now, an NPD individual is not likely to have the motivation to cultivate empathy. An individual with NPD traits may, in fact, have some motivation. Our programs, we have a three-tiered program for men who have patterns of emotional abuse, and they often, after a period of time, work hard to cultivate empathy. When I think about narcissism and narcissistic personality traits, I think about I've done a video called the 3Ds of narcissism. Both narcissistic personality traits and narcissistic personality disorder tend to have that 3D of narcissism. Dominance, dismissiveness, invalidating the other person, and defensiveness. Now, the difference between the two, however, is someone with narcissistic personality traits typically is a bit more open to intervention. Now, notice what I said there, folks. A bit more open to intervention. Are they easy to work with? Not at all. Are they sometimes open to seeing their blind spots, their self-defeating patterns? If there's enough of a breakdown, there can be the possibility for a breakthrough. All right, what I want to do now is I want to talk just specifically about NPD traits. So again, let's understand that someone with NPD, if they've got all of those markers of NPD, the possibility of change is really dire. It really is. How do we know whether someone has NPD or NPD traits? Well, there's one way to discover this, and that is an intervention. And I've got other videos out there. I won't do that right now, but I've got other videos on intervention. Please see those. The response to the intervention tells it all, So if she leaves the relationship, the mate leaves the relationship and says, look, I'm out of here. And if you want to get treatment, super duper, the response to that, it takes a breakdown to have a breakthrough. Please remember that. I wish I would have coined that bumper sticker. It takes a breakdown to have a breakthrough. So the response to the intervention tells us everything. So there's a breakdown. How does this individual respond? Now, typically the response to an intervention is anger at first, but after the anger, do they have some degree of remorse? Do they have some degree of insight? Do they have some degree of willingness to look at blind spots? Do they have some degree of willingness to see how manipulative and emotionally immature they are and how much inability they have to receive critical feedback? Are they willing to look at their levels of invalidation? So all of these questions, when I'm asked the question, Dr. Hawkins, will my mate respond to counseling? I don't know. I don't know the answer to that, but we can know. We can know. And how do we know? An intervention, the breakdown that leads to the possibility of a breakthrough. All right. I hope this has been helpful to you to clarify what's the blurring between NPD and NPD traits. NPD, very dire prognosis. NPD traits, possibilities. And I will help you, and our team will help you discover just how robust those possibilities are. All right, if we can be helpful to you, we've got a client care team ready to answer your questions. We will help you determine the path forward. Give us a call. All right, take care, and as always, God bless. Hello, I'm Dr. David Hawkins, and I have developed a program for men called The Core. It is not marriage counseling. It's a radical program designed to shift how a person thinks, how they feel, how they relate to himself and to others. And yes, it works even for those who have no empathy and don't know the first thing about understanding and meeting your needs and wants. If you are looking for help for someone with narcissistic and emotional abuse issues, please consider our comprehensive core treatment program.